The National Primary Healthcare Development Agency, in partnership with the World Health Organization and the United Nations International Children Education Fund, UNICEF, held the second annual Primary Healthcare Lecture, which focused on creating sustainable primary healthcare financing. The event, which had in attendance notable personalities, emphasized the need for primary health care to be readily available in the country. In a speech delivered by the Emir of Jiwa, Alhaji Idris Musa, primary health care has been relevant in the eradication of some diseases in the country, and it is one which will assist the community at the lower level, but hasn't been functional because of lack of manpower and funds.
So I'm appealing to Primary Health Care Agency to liaise with the federal government to have more legislation so that we have more arms to see that the primary health care emergency, what the primary health care goes to the grassroots.
Dr. Bupalda Pokap, who spoke on behalf of the president of the Nigerian Medical Association, Professor Michael Girima, advocated for the implementation of the National Health Act, which he claimed would aid proper disbursement of funds.
For every call, all of us here make calls. For every call, can we now say 1 naira at least goes to financing healthcare in the country? Those are innovative ways that we can get healthcare financing for Nigerians.
He called on the government to partner with faith-based organizations and also did not fail to acknowledge the efforts of state governors who were part of the 18 awardees recognized for their impacts in the primary healthcare delivery in the country. He, however, had this to say in his interview.
Every other tax that is taxable in this country, a percentage goes to the health sector. By the time we do that, we are going to go a long way to realize these funds that we need for the health sector, for a sustainable, financing of the health sector.
His Eminence, John Cardinal Onayeka, sees primary health care as part of the mission of the church and seeks to rekindle the relationship of the church with the federal government on primary health care.
So when we are talking about partnership with government, the church is not asking for money. The church is only asking to be put in a position to serve the poor people.
In a speech delivered on behalf of Dr. Isaac Oluwale by the Director of Public Health, Dr. Evelyn Ngige, the need to tackle the challenges facing the implementation of primary healthcare funds is pressing, and one key challenge is how to provide healthcare services for Nigerians without the out-of-pocket funding, which puts citizens at a risk of financial hardship. He, however, expresses displeasure on the fact that healthcare allocation still remains below 15% in the national budget. Finally, the guest speaker, Professor Obina Onwujekwe, summed it up by saying Nigeria has a weak healthcare system, with under 5 mortality rates standing at 58%. He expressed his displeasure at the absence of primary health care in the 2017 national budget.
So what we have now is an unsustainable, ineffective, and inefficient way of financing the system, an inequitable way. And it will never lead this country to achieve any reasonable health outcomes if we continue this way.
He, however, said that a fully functional primary health care will improve total health care in Nigeria.